Hi guys, welcome to my YouTube channel. If you're new here, my name is Hypermedic, you can call me Kiki. I am the CEO, writer, executive producer, manager of this channel. I am a beauty vlogger and as well as a medical student. Previously on our last episode, we were advising first-year medical students on how to survive medical school and any tips and tricks that they may find useful. And today we're going to be focusing on third and fourth-year medical students, whatever year it is, that are introduced to hospital-based teaching from theory. So today we're going to be talking about your demeanor in the hospital, what you should wear, what you should expect, how your exams are going to look like, and just basically the common things that happen commonly. I think I should put my hair back with this, just so it doesn't get in the way. Okay, so our hair is back and I'm ready to film. I've really been trying to film and edit the past few weeks, but I've been deleting the content. I'll insert the content right here, I have some of it left. I've been deleting it, I've been failing to edit it, so whatever happens in this video, I'm just going to post it as it is. I'm not going to do much editing because I'm tired and we need to move on to other bigger things. So Ashley though, but we can fix it. Of course, we'll be doing our makeup today, and while we're doing so, I'm just going to talk you guys through what third year is really like. And before that, I just want to address like a little something. The reasons why I make these videos is because when you come to medical school, not all of your friends from high school are here, so you basically have to start all over again and you don't really know anyone. And I feel like these videos are a great way to prepare you guys in a way that we were never prepared. We're just like thrown in the deep end, and are you going to swim, are you going to sink? So for as long as you're prepared and you know what to anticipate and what to expect, I think that's like the greatest thing ever. Your third, fourth year should be the most exciting year of like your entire career, because you're introduced to the hospital, you're introduced to different things, you're seeing things for the first time, and you're learning so many things and you're doing so many new procedures. So it's like the best. I think it was like my best year in terms of just life capacities. You'll notice that your modules are going to be slightly different. Most of them are going to be a continuation from your second year, but the other half are going to be a new introduction to general surgery, obstetric and gynecology, internal medicine, pediatrics, and all of those major disciplines of medicine. So it's really like you're really going to be taught on how to be a doctor. So I'm pretty sure at this point you guys have entered clinics, you've worked at different branches, district hospitals, so you have a general idea like how to conduct yourself in a hospital, how hospitals work, and all that stuff. But this year you're really getting like in-depth teaching, like you don't do this, you do that, be able to recognize an emergency, and just all of those really important things. They really want to emphasize on history taking and physical examinations. So you need to be able to show that and show that you're capable. I'm just talking, I'm not even doing my makeup anymore. I'm going for a very natural beat today. I always say that I end up with like glitter and on my face, but I want to go all natural today. Yes, just be a girl. So we could talk about you guys' modules. We could talk about how to cope in the hospital. We could also talk about your dress code, how to protect yourself, and what else can we talk about? Yeah, let's talk about exams. Let's talk about exams as well. Your schedule is really based on what your department is doing and what they expect from you. So usually with each department they have morning meetings which take place at 7:30. This is where like all the admissions are presented, and you really get to learn a lot because sometimes they have presentations, they have journals, they sit around and talk about like things I never hear them. Morning meetings at 7:30, and then ward rounds, and then OPD in the afternoon, and calls. So those are like the major things that really happen at the hospitals, but it depends on your department and your rotation. So our year was really hectic. We had to go to the morning meetings at 7:30 in the morning, do ward rounds from the time the meeting ends until 1 o'clock, have lunch from 1 to 2, go to class from 2 to 6, and after 6, like around 7, depending on what your firm is, then you have to go on call until 10 o'clock, and then go read and wake up again early to see your patients before the 7:30 meeting, attend the 7:30 meeting, and start all over again. I think it's a little different with you guys because you don't spend as much time in the hospital in your third year, at least not in this semester. But I guess in your next semester and in your fourth year, that's when you're really going to feel it. Ward rounds is when patients are seen in the ward. So they're seen one by one and they're presented to a consultant. So the hierarchy goes like this, at least in this institution. There's a consultant who's a specialist, and then a medical officer, and in between should be a resident, but there's no training there, and an intern, a medical intern, and then medical students. That's a hierarchy of like the medical discipline. So the consultant is like the top dog. He runs the ward, and the patients that are admitted in the ward, you have to present to him or her every morning and find out what's going on, talk about like, okay, what's going on with this patient, are there any complications, etc. So like this, like you go to every patient one at a time. Really important to ensure that like you know what's going on in the ward, how many patients are there, what diseases they have, so you know what to read up on the night before, so when questions happen you know what to answer. So during these ward rounds, this is where like basically the bulk of the teaching is done by the consultants or a trained medical officer or even the interns. You learn from everybody basically. So they're usually in charge, the consultants, of the teaching. So you learn a lot from ward rounds. So don't shy away from presenting patients. Don't shy away from just finding out, asking questions as to why. They can be very intimidating, but that's where you learn. You learn through that, and they'll really put an emphasis on you guys seeing the patients like 2 at a time or 1 at a time, of course with their permission, and clerking them and doing an examination on them, and then presenting to them like, okay, this is what I found out in this patient, and this is what I think. And they'll give you training on how to do all of that stuff. And basically the hospital is just like, it's like a practical session. It's everything you've been doing since first year and in the district hospitals when you go during holidays, but now it's just like it's practical, and they guide you like, okay, when you do this, you don't do it like this, you do it like that, da 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 da. It's pretty easy. Now that I'm explaining it, I'm like, why did we used to suffer? Okay, so let's continue talking about ward rounds. They can be like the most stressful event of your entire day, especially if you're not prepared. So all that reading you've been doing since first year, it boils down to the moments in the ward rounds. So basically, they want to find out, what do you know? And I can teach on that. So if you don't know anything, it's basically like, how am I going to help you? Where do I even start? So they usually like, if you're going to general surgery, read about thyroid swellings, read about acute abdomens, read about breast masses, breast cancer, fibroadenomas, read about varicose veins, because those are the things that come very commonly in surgery, and those are the things they expect you to know, and those are the things they're going to test you on. It's really easy. And if you don't attend hospitals, obviously you're not going to find out this information. Like, you're not going to know what they really want you to know at your level, because you're not reading and you're not attending the hospitals. So it's really like, it's all up to you, right? And make sure that you're on top of your game. If you don't understand something, if there's a senior, like if I'm in the same rotation as you, you're more than welcome to come to me and ask me something. And if I truly honestly don't know what the hell is going on, then I can ask somebody else who knows. Ward rounds generally run for a very long time. So guys, please, I cannot emphasize this enough. Eat before you go to the hospital. Eat. or else you end up fainting. I know the first few weeks of my rotations, I was like, what in the name of falling apart and dying and is going on? Eat before you go to the hospital. Just eat anything. Make sure that you eat and wear very comfortable shoes. Usually you can buy shoes from like Crocs and they're really expensive. They're like 1,000 and something. But if you can't, alternatively you can buy from Shoe City, anything that's comfortable. Do not wear pumps, don't wear heels, wear closed shoes, and just make sure that they're comfortable for you. Right, what else do you guys want to know about ward rounds? It's a fair warning. People in the hospital tend to be very rude to medical students, especially if you're like, it doesn't even matter what year you're in. They just tend to be very, very mean. And guys, just suck it up. Like, you're in a very professional environment. Don't let your feelings overwhelm you, and know that it's not a personal attack on you. Some people are just like that. They're just really horrible, terrible people to work under, to work with, and to be in the same space and environment as them. So always have a very positive mentality when you're going to the hospital, no matter what. And even if they say things to you that are just out of this world and you're going through something, have a great support system like your friends that you can talk and laugh about and be like, yo, it was just so completely terrible to me, or whatever the case may be. Can I blend this out before I continue talking, because I look like a ridiculous human being? Another thing we really need to talk about, guys, is your health. You guys, there's nothing more important than taking care of yourself in the hospital setting. Hospitals are generally very dirty places, and they're filled with people with various kinds of diseases and things like that. So you really have to, okay, let me just get around this. You really have to take care of yourself, you as a person, as an individual alone. You need to ensure that the school usually arranges for this before you go to the clinics in the first few years for your hepatitis B vaccines, because you're obviously going to be working in hospitals, so you need that. And make sure that you follow up on your appointments and you get all your vaccines done, so that you don't catch something in the hospital. So you're working in places like casualty or big room, wear a mask, like really protect yourself, because if you catch something like MDR, you are going to not be in school. The school is not going to be like, yeah, no, we just love this person so much, and yeah, they can come and see the patients. They're going to lock you away for like a month, getting injections every other day or every single day, and it's like the worst thing ever. So really protect yourself. Make sure that like you're not touching needles and all of these things. You're gonna get training on what to do. I just want to re-emphasize, because if you get something, like, the school will not pay for your hospital bills, really. Like, they won't. They'll just watch you and be like, yeah, so we'll see you next year. And you don't want to walk around with something that you never had before and you just got it in the hospital. Know the protocols. If you prick yourself with a needle of somebody, whether they're HIV positive or not, know the protocols of what to do, inform somebody, and get on PEP, which is like the worst thing ever, because the side effects are completely terrible. But do that and just really take care of yourself, guys. Like, wear masks, wear aprons, wear gloves. Don't just touch things wherever you go. Don't sit on patients' beds. Don't do things that are unnecessary. If you don't have to touch it, don't touch it. It's really that simple. Let's talk about your attire and your dress codes. Rotations like internal medicine are very strict. Require you to only wear white clothes and then your own silver clothes underneath. For ladies, you're not allowed to wear ripped jeans or jeans. All the guys are not allowed. No one is allowed to wear jeans, basically. Point blank, period. You're allowed to wear pantsuits and skirts and dresses that are like below your knees. That's it. And closed shoes. No open shoe. What situation? No. For the guys, you're allowed to wear t-shirts. Is it a t-shirt or is it like a shirt? What are those official like shirts? Okay, an official shirt with a tie and a white coat on top, and official pants or whatever, and then your shoes. Whichever that you're comfortable with should be closed. Other rotations though, they require, you can wear that or you could wear scrubs. Our colors I don't even think there are colors, it's just like colors that we prefer at our university is burgundy and navy blue. So this is going to dry up. What am I doing? Can I just blend this out first? So you should always have your tag on so people can identify you as your third year, you're a medical student, your name, what your name is, and what institution you're from. Make sure that you always tie your hair back. You look clean, you look prim, you look proper. You don't have like excessive earrings that will distract you. And if you have piercings like I have my piercing, it's not a problem as long as I don't have like a hoop dangling on my nose or something. Things like tattoos, generally nobody has a problem with it, but some people are very conservative and they'll try to oppress you and be like, hide it. So there's that. So you just have to figure it out when you get to that point. Why did I forget to talk to you guys about exams? Exams are like the most stressful thing on the planet. Bro, like you're going to suffer. The trick to that is that read every single day. Read. It doesn't even matter like what you're reading or how long it takes for you to read. If you're in a rotation, like general surgery, read about, because this is what will always come. No matter what, third year, they'll always ask you to examine a thyroid mass, a breast, an abdomen with a mass in it, and an inguinal hernia, maybe a varicose vein. And I don't think you guys have like critical station in your third, fourth year. That's like fifth year level kind of things. So those are like, it always has to come. Always. Internal medicine would have to be a respiratory examination, a cardio examination, and an abdominal examination as well. And sometimes neuro. Sometimes. Obs and gynae, it depends. Just know things like normal labor, how long it takes, that kind of stuff. That's easy. Pediatrics, similar to internal medicine, but just in babies. So in terms of evaluation, you usually evaluated at the end of each block or a certain period of time. So after a certain rotation that you're in internal medicine or general surgery, you write a test, end of rotation test, to see what have you learned and do you even know anything, and if not, I'm sorry, you failed. And yeah, come back next year. Exams are usually very hectic because now you're becoming like a senior. I remember our exams were really like one after the other. Like you have a whole week and you're writing on Monday, Tuesday, Wednesday, Thursday, Friday. Monday, Tuesday, Wednesday, Thursday, and then you're only writing like the next week on a Tuesday. Something crazy like that. So you don't really have much of a say when it comes to the timetable. So that's why you need to prepare yourself ahead of time, and they usually send the timetables out like 2 months in advance or something like that. So you know that, okay, this module and the other module I struggle with, so let me start reading those modules now. Generally, you should have an idea what works for you during your exam. Some people like to study alone, other people prefer being in a group. What works for me is my friends. I am basically a sponge. I just stand there, listen to what they're saying, confirm it, and that's it. That's how I get my information. And usually we would read in a group, and especially like with modules that are like not even a day apart, like you're writing today and tomorrow and the day after. I spent like 3 hours trying to figure out the most important things, because that's all you really need to know, the important things, because you can't cover everything. And then I sit around with my friends and we talk. What did you study? What did you learn? And stuff like that. And that is just how we managed to make it through. So if that is going to work for you, that's like a trick you want to inherit from me, then you're more than welcome. If it's not, then I'm pretty sure you'll find your way and find out what works for you and how you're able to retain information. Boom! Lash, doom, ooh, yeah, lash, eyelashes, eyelashes really just put the whole look on another level. here's the final look, guys. If you found this video to be informative and useful, please share it with other people that may find it useful as well, and comment down below if there's something that I've missed out, and then we can have an open discussion and help each other out. That's what the point of this channel is all about. So with that being said, thank you so much for joining me, and I appreciate it so much. Be strong, work hard, and look cute all the time. Don't be caught looking crusty. And yeah, thank you so much, guys. Bye.